Hello and welcome to Anatomy with Dr. P. In today's video, we're going to be looking at some of the blood vessels in the lower limb. So if we recall from last time, this artery right here that's branching off of the common iliac artery is known as the external iliac artery. That external iliac artery is going to pass down into the thigh, and as it passes into the thigh, it becomes the femoral artery. Remember, the large bone in our thigh is known as the femur, so this femoral artery is going to run right alongside it. And for those of you who are going into nursing or another medical profession, the femoral artery is a very important artery because it's a location where we can take a pulse from. As our femoral artery extends down into the knee region, we can see that it now becomes a different artery known as the popliteal artery. Remember, the word popliteal refers to the back of the knee, so this is where our femoral artery curves around the femur and goes back behind the knee. This is also an important pulse location. Now, our popliteal artery is going to divide into two separate arteries. The first artery is going to run alongside the back of the tibia. We refer to this artery as the posterior tibial artery, and as it comes down to the ankle, it's eventually going to run into the bottom of the foot where it becomes the plantar artery. The posterior tibial artery is another important pulse location. We can feel a pulse for it right at the ankle. Running along the front of the tibia, we have our anterior tibial artery. The anterior tibial artery is going to enter the top of the foot, and as it enters into the top of the foot, it becomes known as the dorsalis pedis artery. The dorsum of the foot is the top of the foot. Ped is a Latin word that means foot, so dorsalis pedis literally means the top of the foot artery. This is another pulse location, so you can feel a pulse by placing your fingers on the top of the foot. In terms of venous flow, we only have a few veins we're going to learn in this class. The first vein is this one that runs along the lateral aspect of the leg region. This is known as the small saphenous vein. Saphenous comes from an Arabic word which means hidden. Running along the medial side all the way from the leg up through the knee into the thigh region, we have this very large blue vessel known as the great saphenous vein. The great saphenous vein is important because this is a vein we can actually go in and harvest. That means we cut it and remove it from the body and use that to help form bypasses in the heart. This deep vein that we see running alongside of our femoral artery is known as the femoral vein. Now, our great saphenous and our femoral vein are eventually going to merge together and dump into the external iliac vein, which is going to head back up into the pelvis and abdomen region.